Hi, my name is Francois Prizinski. I'm a doctor of physical therapy and fellow in training at SportsMedicine of Atlanta's Orthopedic Manual Therapy program, which is accredited by the American Physical Therapy Association. I've been invited today by Dr. Bob Duval in Oakworks to present the PT 250 two-section table and how the application of this retractable headrest that can decline, moving advantageously for a manual therapy practitioner when performing cervical spine techniques. If you haven't caught our first few videos, the first one we looked at an emphasis for screening procedures with vertebral artery insufficiency testing, some of the current literature and clinical pearls and recommendations for that area with patient safety in mind. If you haven't seen that video, please check it out. The other one that we looked at was for special testing in ruling in conditions for specificity positive likelihood ratios in using upper cervical spine cervicogenic headache feature flexion rotation test. If you haven't seen that, I urge you to do so. It's a pretty good test. So with this third segment, we wanted to look at mid to lower cervical spine. We chose a particular technique that we're going to consider that is very common. We're considering this to be a local symptom feature reproduced with active range of motion. We're also considering all screening procedures up to this point has extinguished any red flag findings that may warrant a medical referral between vascular, ligamentous, and neurological, major pathology. Okay? Those features have already been considered and extinguished. So we're proceeding further into our cervical movement-based exam. So can I get you to come over? We're going to talk about this. Let's have you sit over here and we'll face this way. So what we're going to look for is a very common symptom feature for cervical spine pain that is reproduced upon active range of motion. Go ahead and pretend like you're driving your car and you're going to look in reverse, okay? This position of extension, rotation, and some side bending is reproducing our chief complaint here. And she points, she says, right there, that's my symptom, okay? So what we're going to take a look at today is, go ahead and look straight ahead there. What we're going to look at today is taken from some of Jeffrey Maitland's work, okay, looking at active physiologic range of motion to reproduce what's called the comparable sign. The comparable sign is symptom reproduction of what the patient is complaining of. We're nailing this down actively, active physiologic range of motion. The next piece that we're going to look at is passive physiologic, and we're going to show you how to use the table to find the right area and ergonomically set yourself up so that you're able to reproduce a good assessment and employ a treatment technique with ease upon using some of Oakworks products. The third area is the accessory joint mobility assessment. That's where you can just transition right into treatment rather quickly. So we have active range of motion. She looks over and says, that's my symptom. That's also going to be the area where we will reassess that active position because that relates to function, driving, okay? So let's look at passive physiologic next. So what I'm going to have you do is just lay on back for me. One unique feature that I really like in clinic is using this saddle seat. It's a real fancy and unique design. The reason I like it is that saddle, as you would imagine, would mean adducting and making sure that my center and base of support is really going to be an advantageous position for me when I'm using these manual techniques. Also, conveniently being able to position my patient with the high-low table will be advantageous. Now, this is a right-sided symptom feature, so I'm going to get onto this side. And what I'm going to have you do is go ahead and I want you to slide off for me here. And so with Oakworks' smooth transitioning table, I can get to that T2-3 area of that upper thoracic spine to get my patient in a nice position. I'm going to employ the chin cradle grip, okay, where she's just going to rest. And I'm just going to make sure that she's in a comfortable position right here, okay? And so my assessment now is going to be for passive physiologic motion. So I'm just going to take her through some range of motion. As you know, rotation and side bending are coupled in the cervical spine, and I'm looking for her to say, yeah, that's my symptom. So now passive physiologic is confirmed. I'm going to now move into accessory assessment, where I'm going to drop her into a little bit of extension and assess joint levels from this position until she says, yes, that's my symptom. Now, I may move right into treatment from here, but of course, this is not a beginner level treatment technique, which would require significant mentorship and supervision from experienced therapists and continuing education, similar to that offered at Sports Medicine of Atlanta's fellowship program. Okay, so I'm going to employ my mobilization technique at the involved area. Once completed, I'm going to have the patient return to a comfortable position. I just did that with my knee. Go ahead and scooch back down. I'll have the patient just relax for a minute, let things sort of settle back down. We're done, right? No! Go ahead and sit on up for me. And we're going to reassess, okay? So now I want you to do the same maneuver. Yeah, just look at me, right? Just go, pretend like you're going in reverse. And how does that change your symptoms? Asking an open-ended question, not saying, is your symptoms better? Are they better? The patient may just say, yeah, and that may bias your answer. So how does that change your symptoms? She might say, better, worse, or the same. If she says worse, that's okay. I may have to tweak my setup or change my assessment process from active, passive physiologic to accessory mobility gliding and change maybe the vectors that I apply those mobilizations. So thank you, and thank you for watching.